Hi, everybody. It's me, Dr. Kathy, again. Good to see y'all. All right, today is a very interesting topic that I have for you guys. This is about having seen the men's side last night. We're going to talk about the women's side. Women, are you sexually satisfying your partner, your man? Word on the street is that you are not. No, I'm just saying that some are not all. But I would like to talk about this because it's such a beautiful topic. It's something I see in my office all the time. And I want to categorize it the same way I did with the guys last night. Four categories, right? But we have a few points extra for the women. Okay, so let's start with number one, upbringing. Upbringing, we know, affects all of us. I was lucky to have a beautiful upbringing and sort of liberal. But I know a lot of people were not able to have that sort of loving environment, someone that I could talk to each stage of my life as I grew, up till now, thank God. But women that don't have someone to talk to, or have a role model, or have someone that they can really reach out to when they have questions, it's tough. Now, obviously, we do have some people we reach out to, and sometimes they give us the wrong answer, right? Same thing with the guys. Sometimes if we get people that are not very knowledgeable about this subject and they give you their own perspective. So, my point again is upbringing can devastate some of us women. And that not being able to talk to someone and get great advice from someone that really is experienced in sex, which of course, you know, is going to be hard to find. If you're lucky, you're lucky, you found someone. So this is not for you if you're good. This is for those that really feel that they missed out on something growing up. I know many people that have missed out and so have internal issues dealing with sex with their partner. So you need to find someone to talk to that knows what they're talking about. Again, some doctors like me, friends, the church, I tell you this all the time. Find someone that knows what they're talking about. And please, the church, you got to be specific. The sexual therapy department in the church, right? Couples therapy, right? So another reason, of course, we said is religion. So religion sometimes can make women feel that you got to wait for marriage. And I know I shouldn't say this, and so I won't say it. Actually, I'm going to say it. I don't believe in waiting till marriage. I think that I've seen too many people that have waited till marriage and found out that the man didn't even know what he was doing. Couldn't even find the area to work with. And I don't mean that as a funny joke. I mean it more as a serious note that women that find out later on tend to end up very unhappy. And men too. Again, this is for both men and women. I hope you're all listening, both men and women. You are supposed to be able to communicate. And to do that, you've got to have that liberty, that freedom, that freeness within yourself to be able to talk about sex with anybody like that. Snap of the finger, okay? So religion sometimes puts a lid on that. It's changing, we know, right? I've spoken in some churches, but again, there's some topics I cannot touch, right? But here, I want to say very freely, find a church that does accept most of what sexual activities nowadays involve so that you can be open and talk about it, okay? And I know they're out there, so just keep on searching, okay? So that's the upbringing part. Now, there's one more part in the upbringing part I want to mention for women, because it doesn't apply to men as much. Looks, right? So when we have a look, that can be looked as being very negative. If you're obese, you're fat, ugly, you're going to see that sex is not something that will come your way. And that's just the way of life. I'm giving it to you straight. So you got to make yourself sexy, right? You got to get down that weight to a good size, right? And I'm not going to tell you what that size is. You do your best, you get down to the best weight you can get, and then you find that you attract men easier. Now, I know there are guys that like big women. I'm in the South, I'm in Atlanta. I know this, I see it and hear it every day. So kudos for those that can catch men of any size that don't mind women of any size. Go for it. But generally for health and generally for good sex, even though I know big women, big men are enjoying the experience between the sheets, the weight doesn't stop them, doesn't hamper them, but eventually it can. Just beware. My advice again is try and overcome the looks. Be confident, make yourself look as the best you can, right? You are going to really want to get, I always say this, get a coach that will help you dress, right? And some of these image consultants are very good. And they have women that actually just dress women too. So again, find someone that will help you dress, do your hair, do your nails, which is why I brought some of these things here for, I guess, my niece. She's gonna probably grab these once I'm done. These are, nails, clip on, stick on, press on nails, right? And we've got makeup, very important, not too much, especially this pink Barbie makeup. Notice I didn't use it, right? Then we've got, accessories. You want to accessorize, make yourself look pretty with, chains and simple chains, right? And of course, the sunglasses. Love the sunglasses. Yeah. Always looking cool, right? Especially when it's sunny. Now it's getting colder now, so we don't really need it as much. So you want to make the effort, and I already know that we do, but be careful because you want to look presentable. You want to look in such a way that you can attract the opposite sex, if that's what you're looking for. But remember what they said to you as a child: you were ugly, you were fat, you will never get a man if you look like that. Should not have been said to you. And I do apologize for you hearing that from someone in your family, if you did hear that. But I'm hoping you've overcome that. If you need to get counseling for that. But usually by this age, as an adult, you should have come over that, and you should have gotten therapy for that. And I really, again, do apologize for those that have gone through that. So we can go to the next category. That the first category, which was upbringing. Second category is going to be you don't care. Okay, you're selfish, right? So women, again, that are selfish. I am softer with you women, us women, because we know that we're not as tough as the men. We're not. They're stronger and they're more resilient, but we are really the stronger sex. But if you have been brought up with, again, terrible examples of sexual innuendos or things that were said that shouldn't have been said or you overheard. And my classic example is someone trying to masturbate and being punished for masturbating. I think that's horrible. Again, for men and women, it happens. So you'll grow up hating sex. You just don't care. It's something that you just have no interest in. You can get help for that, okay? But be aware of it. It's not right. It's not, I'm not going to use the word normal. It's not within the functioning abilities of a relationship to not care, okay? We can go on into whether there's a psychological issue, again, PTSD, bipolar, schizophrenia, psychopaths, sociopaths, narcissists. It could be any of that going on. But please, if you find that you don't care, seek some help to find out whether we can change that. I know it's not easy for some, but if it's a mild selfishness or a mild I don't care, yeah, there's help, which is very severe, innate, deep. You're going to need very intensive counseling for quite some time. And with the help of your partner, hopefully. So be open with your partner. Another category I like to talk about, of course, is pain. If you're in discomfort, if you have some sort of surgery or a chronic illness or an ailment that you have had for a while and you know you're going to have for a long time, I understand it can be debilitating, but you really want to address that as soon as possible, minimize it as much as possible so that you can partake in having great sex with your partner and pleasing your partner. Women, we've got to please our men. Our men complain, but we know they have their own issues. Remember what I said yesterday. Just go back to what I said yesterday, what we talked about. But we have to be more gentle with men, again, probably because we're stronger, but mostly because men don't open up and are not very good in communication, and we have to sort of pry from them sometimes what they want because they don't want to hurt our feelings. That's how they're brought up. But we too have to be careful and be honest in what we're saying to them, the truth, and not hurt them and not try to undermine them because they still have to be leaders and they have to be men, masculine, right? And we don't want to emasculate them, which is very easily done by women, right? So we gotta tie our tongue. I always say that. Keep control of that tongue so that you're not going to lose out on a man that loves you, and lose out on any man that could love you by using your tongue. So we must learn to be more feminine and more uh, better at communicating with our guys and less aggressive, which is what I have learned over the years myself. And I've really enjoyed the lessons from that. And I hope you to understand that as you are not enjoying yourself sexually, to flip that around, to flip the switch, you really need to look at yourself in the mirror and say, you know what, this starts with me, and change how you talk to men and how you approach men. Even though I know men can be men, we still have to acknowledge that there are some great men out there and there are some men that we should run away from. And that's up to us to decipher and put our spidey sense up and know the difference and run when you need to run. Okay. Of course, get help if you need to get help. But the truth is that there are many women out there that don't care and want to hurt their partner. And that's why I'm saying you have to get some help if you're psychologically diagnosed with one of those diagnoses or any diagnosis that might be interfering. But there's also self-worthiness. If you don't think yourself worthy, you're not going to want to have sex. So that needs help, right? Counseling. There are people that just think sex is a job. Just go and do it and that's it. You don't have any enjoyment. That's not right. We need to find those erogenous zones, and we've got to find out whether there's something going on psychologically or even physically, right? So we got to address those issues and not let it continue. Okay. Then we have those that can't have orgasms, and so they don't want to have sex either. So they're not satisfying their men because they're not going to get satisfied, and that's not fair. Satisfy a man and teach the man to satisfy you. I said that yesterday. I'm saying it again. Satisfaction depends on communication, honest communication. Okay. Those that feel rejected, right? That means men reject them, will not feel like having sex. So men, be careful how you treat women. And I know a lot of you men are very careful, but women that have been rejected are scarred. And again, they need to get some help, need to get their self-confidence back. And there are ways you can do that. I'll talk about that in a few minutes. All right. Third category is that you are incapable of enjoying yourself. We're still in the third category, yeah, because you might, as a woman, have something called female hypoactive sexual disorder. I'll say that again. It's a mouthful. Female hypoactive sexual desire disorder. Okay, that is a serious diagnosis, and that diagnosis happens when you experience 3 of these symptoms. I'm going to give them to you. I'm going to give you 6 of the different symptoms you could experience. If you have 3 of them for 6 months and it interferes with your relationships, you have female hypoactive sexual desire disorder. Okay? And it's very important for you to recognize that. Now, there are other disorders in the DSM-5. There are other disorders that are out there regarding having issues in the bedroom, having issues sexually. But this one is the beginning, and it really is more common than we realize, okay? So I'm going to give you the 6 symptoms, and if you have any 3, seek help. Number 1, lack of interest in sex. Number 2, lack of thinking of sex. Number 3, lack of taking the initiative in sex. Number four, lack of excitement about sex. Number five, lack of being aroused when someone approaches you, your partner, just nothing that is on fire. You're not aroused. And number six is lack of feeling, sensation, right? So there's nothing when he touches you that happens, right? There's something that's supposed to happen. And if that doesn't happen, something is wrong. And that's part of the I don't care attitude, right? That third category, right? So we're gonna recommend help. Not easy to treat, but there is help. And I always think of hormones first, balancing those hormones, getting those hormones checked, making sure your testosterone, your progesterone, your estrogen is perfect or close to perfect. Because if they're not, you can link some of that to some of these symptoms. So if you have any of these, three of them, any three of them, for 6 months, your diagnosis will be female hypoactive sexual desire disorder. Okay? Now, again, there are spectrums of this stuff, and I always feel that everything has a spectrum. So don't feel you've got to be exact. If you have anything in that category that's even close, and let's say you're more than three, or you're two, or you're one, still seek help because these things can be treated. And I'm going to start with the hormone levels first, and of course the psych and the physical and all that will get your physical done. Okay. All right. Fourth category, I brought it up with the guys too, and that is lack of attraction. You've lost attraction to your partner, right? Could be boring partner, right? So your man could be boring and you're just not in love anymore, right? Or it could be that you're just not interested in him because your preferences have changed. I mentioned that yesterday also. I was having an argument with a psychologist friend of mine, and he thinks that this can happen at an older age. I don't believe that. I believe you know your preferences from birth. I believe you know who you are from birth. Now, it can be confusing as you get into your teenage years. You're going to be like, who is this? What is this? Why am I feeling this? Yeah, but you have a sense of disease. You have a sense of, something's not right. Not, I had no clue, and suddenly out of the blue, you're not attracted to your partner because it just happened. I don't believe that. I could be wrong, but I really don't believe that's the case. I believe people have an innate knowledge of something being different about them. I hear that time and time in my practice. So for those that say that it happened later on in life, okay, I have to respect that. But personally, I've not seen that, and I really do think that it's there. You might have ignored it, been in denial, but it can happen. And if it happens, admit to it, because your life will be miserable until you do admit to it. I believe in coming out and being honest with who you are and what you're feeling, and even finding out whether it's you or not, so that you can make a final decision, because it takes time sometimes to make that decision as to which way you're going to go. And I'm okay with that. Okay. All right. So those are the four categories. I do want to say that you've got to intervene to improve this, so that you are addressing your partner's sexuality and his needs. And men need it more than us. I tell you that men, this is their defining power, sex. And if you're not able to satisfy them, that's doing a big injustice to them. So I encourage you to find ways to satisfy them. If you cannot, get help. Speak to a doctor like me, find a doctor like me, or a doctor that can deal with your reasons as to why you think you're having a problem. Okay? Now, before I go, I always ask couples to do this little test for me. Okay? The lifestyle modification is something that you can do to change your outward appearance and be more positive in stepping into that new role of the new you that wants to be more sensual and more attractive sexually to your partner. Okay, that happened to me. I wasn't always like this, even though people think I was. I was not. Oh my gosh, forget the pictures. But honestly, it was with time that I got to understand that life is more than just work, 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 right? So you find out what's important to you. And again, a partner is very important to you, even though sometimes we feel that they're not. They're the most important thing that you could ever have in your life, a great partner. Your children are very important, but your children will grow up and disappear, right? So you want someone that's going to be with you for as long as you can have a partner if you're blessed. And we know those lucky men and women that have been with their husbands and wives for long, many, many years. But the divorce rate is so high. So we know that in Atlanta, the ratio of 18 to 1, I don't even know if it's higher now, is there. So it's hard to find a mate. So when you find one, do everything you can to keep your mate. But I was saying 5 categories, right? That I always ask my couples, my clients, my patients, if I'm counseling or coaching, give me in order 1, 2, 3, 4, 5, what is important to you. So I ask them to categorize sex, looks, love, money, and brains, and see whether that's something that they can put 1, 2, 3, or 5. And when I match them up, is sex is opposite. Someone says sex is 2 or 3, and that one says it's 5. Then there's a mismatch there. So you want to now try and bring them together so they can see that that's important to the partner, and they can sort of like work on that and improve the mismatch and the difference in opinion in terms of how important something is to someone you didn't know, so now you know. So that's one way of looking at it. Okay. I digress, but that's the point I wanted to bring out. So lifestyle modification, losing weight, exercising, eating healthy, not being the life of the party, but just learning and growing and being the better you, the best you can be. I believe in that. Have fun, learn who you are, and grow and never stop growing, never stop learning. Okay? That's lifestyle modification. Education is important. Like I said yesterday, you've got to read, you've got to watch some great movies. And when I say movies, I mean documentaries on sex. There are so many documentaries out there. I always say about reading like the Kama Sutra, that's a good start. And there's so many other things, tantric massage that you can learn. Again, I'm not going to go over all that today, but there's a lot of stuff out there that you can learn on how to reinvent you to be the new sexier you, okay? Now, I don't want you to be too sexy. There has to be some class here, okay? And remember, the men you're trying to attract, you want good quality, valuable, respectable, masculine leaders, okay? All right, so the third thing that you might have to do, again, of course, I mentioned it throughout my talk, is psychotherapy, sex therapy. I didn't mention that yesterday, completely forgot. But psychotherapy, sex therapy will always help in terms of getting you prepared for the new you sexually. And last but not least, medications. I mentioned the blue pill yesterday. Not, I do have given some women the blue pill, but there are other supplements and prescriptions for the women that I use. But the first thing I would think about is balancing hormones to make sure that you are where you should be, because that is what makes you more feminine if you have the right balance of hormones, and makes guys more masculine if they have the right amount of testosterone. But that's just my humble opinion, and you can do some more research, talk to your doctors about that. In the meantime, my lovely ladies, I want you to focus on satisfying your partner, because when you do, your relationship will completely change and will improve to such a point that you'll be saying, oh my gosh, why didn't I do this sooner? All right, y'all. Enough from me. Thank you for listening. I'll talk to you guys soon. Take care. Have a good night. Bye.